So, seeing it's 8:31, we'll call the meeting of the Law and Government Committee to order. Kathy, can I have a roll call?
Sauter. Wagner.
Here.
Hendricks. Campbell.
Here.
Kunkel.
Here.
Shorten.
Here.
Altoff.
Here. Thank you. Seeing as how we have a quorum, we'll go on. Do I have a motion to approve the minutes as presented? Mr. Kunkel, seconded by Ms. Wagner. All those in favor say aye.
Aye.
All those opposed? Motion carries. I don't believe that there is any public comment, but Mike, you want to go down just to Shaylin, thanks.
No.
Okay, great. All right, no public comment. Are there any member comments this morning? Seeing none, we'll roll on to new business. There is no new business as well. Legislative update. I do believe that Alicia sent an electronic report to all of you. Very, very nice, Mr. Austin, Vanna. I will note that July 1 is the big date here in Illinois because that's when all the new laws will go into effect. So that's be the personal leave as well as minimum wage and any of those other things that we are following. But if you do go on, I believe it's ILGA, you can find kind of a list of all those bills that will go into effect. Routine consent agenda. Does anybody want to take anything off the routine consent agenda for explanation? Kelly?
7.1.
And I just would like 7.2 to kind of be discussed a little bit more thoroughly.
Oh, I'm sorry, I'm 7.2.
Was it 7.2? Okay,
Yep.
so can I have a motion to approve 7.1? Ms. Campbell, seconded by Mr. Kunkel. All those, no, roll call.
Wagner.
Yes.
Shorten.
Yes.
Kunkel.
Yes.
Campbell.
Yes.
Altoff.
Yes. All right, Ms.
Good morning.
Delgado. Good morning.
How are you?
Good. Wet. We're all wet.
Yes, I know. We needed it though. I heard we were in a drought.
Yes.
So this resolution we've been talking about since really in November when we passed the current year's budget. So we knew at that point that we were most likely entering into a contract with Lake County. However, budget policy is, I couldn't budget for that because we weren't there yet. We didn't have it signed. There's still issues going on with the Lake County Sheriff and his county board. So we budgeted at the level or the tier in our contract for healthcare at 1 to 200 average daily population. Once we got Lake County, we've been over that, which is another tier and another price. So after talking with Pete and Carrie, we decided instead of doing an immediate budget adjustment that we would wait and see because every day really it fluctuates, not a whole lot, but just to make sure that we maintain that contract, that we wouldn't come back until we got close to exhausting what our current budget is. We're mid-year, we haven't completely exhausted it, but we're pretty confident we're gonna keep Lake County inmates through the rest of the year, and this amount of money is gonna get us through this fiscal year.
And I think the big question is monetarily. The monies that we receive from Lake County will actually assist us in.
Correct. So to date, we just got May's check. We have invoiced them $2,070,300. Out of that, so I know Carrie Weiss gives updates to the Finance Committee, and she includes some direct expenses. This is part of the direct expenses that she pulls out of there. It's that food. Food, we're not really sure if we're gonna need to come back. If I do, it may just be for a month, but we're still kind of waiting to see how that goes because it's literally per meal. So our general average daily population, our general population also affects that. So when we go down, so it's.
Is that contract similar? Is there a tier for food?
No, we took the tier away. It's just per meal for the food. We used to have tiers, but this is just easier.
Yeah, thank you.
Yes.
Ms. Wagner.
I just want to, so when you're accounting for the income and expenses for the Lake County, are you going to then offset the increased health expense from the Lake County
Yes.
budget? Okay, so
Yes.
we have an accurate.
Yes, so
Gary's gonna do a little bit more
it's put in there.
dive on
Okay.
a week from Thursday.
Okay,
Week-
yeah.
Wednesday, pardon me.
I don't necessarily always see those before she does it, but in the resolution, we're offsetting it by the revenue line
Right.
that it's coming in at. And really, so we've got the healthcare and the food. We haven't hired anybody. Our overtime is up. We haven't exceeded it. We're probably gonna exceed overtime some. That's a lot better than coming in asking for more positions to fill. You know, overtime is the best way to kind of offset that. And we're also, while we're talking about people, we have 15 people in the jail. I just found out that are maxed at their year in IMRF, so they could retire at any time if they wanted to. They're at the age and the years of service. So we're hoping they spread that out over the next couple of years and don't hit us all at once, but
Wow.
yeah, that's one big challenge that is coming up because
Lake County's challenge.
we need females. That's really difficult, and that's something that is necessary because we have female inmates and there's things that are specific to them, so.
One
Yeah,
more question.
please.
So budgeting, I mean, I know we're already getting into the budgeting for next year. Do you anticipate on budgeting for the higher amount for health insurance for next year?
Actually, I'm assuming it's gonna go up, so I have worked with, we've had a great relationship with this healthcare company. They've been with us well before I was even here. And for the last 2 years, they've been wanting to increase their fees. And I've been working with Adam on this, and it's been kind of a tug of war because they want to increase fees, but healthcare is healthcare and they're not always fully staffed. So I'm like, well, no, not until you're fully staffed. We're not gonna give you more money, and it just goes back and forth. But their costs have gone up for their nursing, their mental health fees, pharmaceuticals have gone up. And they have said, Sandy, we need to do something. So I said, we're in budget right now, you need to tell me what that's gonna be for next year. So we're gonna budget at that 201 to 400 average daily population, and it's most likely gonna be a little bit more than what the current contract.
Thank you for holding the line as long as you could.
Oh, it's been, yes, yeah, but it's a good relationship too, so we want to work with them, but we've been able to hold the line.
Mr. Kunkel?
So originally, we talked about all this, we were somewhere in about a 70-30 with the cost. Is that where we still will be now with this, or was the uptick in insurance figured in that 70-30?
So, no, but the 70-30 was not the sheriff's office numbers. I think that was a more conservative number that came out of finance on costs. But we probably, like Pete just said, Carrie's gonna do a deeper dive into the actual finances. We haven't adjusted anything in our current budget right now for Lake County until we've done this. So we've been able to absorb all those extra miscellaneous costs, so
But
cleaning.
you're not gonna absorb cleanly the 590, that just isn't gonna work. It's just quick math in my head, 365 days, 150 people. Almost 5 million, but then you're still subtracting 590, that's what, 3.8 million a year? Still to the positive?
A little, probably more like 140. I mean, most nights dance in the 138, 140.
Still, we're looking at still all in expenses out. It's still a net of over 3 million a year.
Yes.
Okay.
And
It's
we
not a
don't.
downside.
No, I
That's
was
still
gonna
an
say, I
upside.
still think it was a wise decision,
Yeah, yeah.
not only in helping, but also from a financial.
So long as not too many more of the 590 surprises come in.
No, there's gonna be, so next year's budget will have some sort of
That
an
baked in,
increase
right.
of adjustment. We're locked in with our food, so that's gonna ebb and flow as,
But
especially
the
our general
food still
population.
falls in the 70-30. That was
It
figured
does.
on a daily rate. So that's, all I'm talking about
does.
is adjustments that take us out of that 70%. And
Yeah.
as you say, that's conservative.
That's
But at
conservative.
70%, I hate to use the word profit margin with government, but as a business guy, that's what I'm looking at. So, okay, thank you. Good.
Okay, I'm not looking at profit margin as much as it doesn't cost us anything. You may look at profit, I'm looking at it.
You look at not
yeah,
losing money,
right,
I'll look
not
and see if
losing.
it gets some.
So,
good.
and can I ask, when does that contract end?
It's a 2-year contract, so once, so the first year is kind of the base year, so November 30th it technically ends. and then they can renew it for another year. They're still down, I believe it's 60 people.
Yeah, I actually just talked to somebody from Lake County.
Yeah.
I don't see that getting fixed
Quickly.
anytime soon, just so you all know. But does that allow us also at that particular time, if we had to renegotiate costs? Asking for what they're paying, or no, that's locked in stone for another year?
So when we negotiated those costs, they were still, we shared what our expenses were, and there is still a profit margin in
Okay,
there. So I don't know how,
Yeah, how good it would be to actually answer more. That's just a question.
Yeah, and speaking to a Lake County individual who remain unnamed, they said it's a good deal for them at
It is.
$100 a day, so.
It is.
So it's a win-win.
both of us, correct?
Yeah,
So
it's a
their
win-win.
personnel costs, although they're down
Right.
60, that's.
But
quite a
that's not their
savings.
focus right now about adding personnel, so that's still a win-win. Okay.
And we estimate, when we put our numbers together, each employee in corrections is about 100,000 a year with salary and benefits average. So if they're down 60.
Big number.
Any other questions? Then can I have a motion to approve 7.2? Ms. Campbell, seconded by Mr. Shorten. And again, it's money, so can we have a roll call?
Kunkel.
Yes.
Campbell.
Yes.
Wagner.
Yes.
Shorten.
Yes.
Altough.
Yes. Next on the agenda is Mr. Wallace. Acceptance of a Department of Transportation grant from the Community Foundation.
Good morning.
Good morning. And congrats, good morning.
Thank you.
I'm assuming this was the application and you were successful and you received funds?
Yes, we got 2 of the 4 grants. We're still waiting on the other 2.
Excellent. So very nicely done.
And we found out about these late Thursday, so that's why there's not a resolution in front of you right now today.
Again, had to go to the doctor on Friday.
And Dan had to go to the doctor next week.
And so before we get into it, what's the intent with regard to moving forward? Having the discussion here and then taking the resolution to finance or?
We're still gonna do 2 stops at Admin Services and Finance. 'Cause
Okay.
This is personal related.
We appreciate this. Thank you very much. Okay, please.
So if you'll recall, when we did our presentation, we had mentioned that there were 4 grants that were out there that
Right.
Kelly and company had submitted for. Thursday, we found out that we received 2 of them. So one's from the Department of Transportation, that's for our DUI court program, and the other one is from the Community Foundation help me out, Kelly, it's for.
So it's a pilot program for an employment specialist. Right now, we're working with workforce, but this one would meet the greater need of it, so.
That's phenomenal. I can't even, after you made the presentation, that is obviously a needed area.
Yeah, so we're super excited.
Do you want to explain both programs and?
Sure, so I'll start with the IDOT grant, because that one, we just need to create the position. The funding that we got through the IDOT grant should cover everything, so we don't need any money for that. And that is going to, like I said, reduce the wait list. Hopefully we won't have one ever again. And like I said, the problem with waiting is we hope they stop drinking, but that affects their treatment if they do. And if they don't, then that affects the community. So we really need to get these people in the program, in treatment, off the wait list. So that is imperative. And then the employment specialist, that one, we didn't have the position graded through HR at the time of writing the grant, so we kind of guessed what the salary would be, and we were under. If it was an individual that applied for the position and got it, we could cover it. But if that individual needed family coverage, that's where the problem would come in for health insurance. So we may need some funding from the county to support that position, depending who we hire. So we're just putting money.
So my question is with regard to both of the grants, what's the length, the longevity? Is it for 1 year?
1 year.
And what's the plan again in the event that the grant runs out and then there's no additional funds? What's our plan?
The Community Foundation grant, you can apply for 3 years. So we're hoping to continue it for 3 years. And then along the way, we'll track the progress of it and probably
Trying to build it into your budget.
that or look for another grant to cover it. that would be ideal.
And transportation, same situation?
The IDOT grant.
Yeah.
That one, I'm not sure how many years we can apply. We have had it before, so we would just continue to apply for it, otherwise build it into the budget eventually.
And one of the
Anyone
things-
have, oh, I'm sorry, Dan?
And one of the things, we'll certainly work with Pete and carry on is reviewing our own budget. If there's things that we can do to shift dollars to offset without growing the budget, that's exactly what we'll do. We certainly try to be good stewards of the money that we're appropriated, so.
Appreciate that. That's always a question during budget time. When we get grants, what happens at the end of the grant? And are we planning to roll it in? Are we ending the, what's the deal? So I just have to ask. Anyone else have any questions at this time? Great. Congratulations. Let us know if you get the other two. That'd be great too.
will.
Yeah, if we get the SAMHSA grant, that'll be a big one, so.
Yeah.
You'll hear Dan yell from wherever he is.
Sorry?
I said, they'll hear you yell from wherever.
No, we won't need notification. We'll get it via. There are no presentations. There is no old business reports. Pete?
Can I just for 30 seconds, well, maybe more like a minute. We were having a good discussion with Sandra about the jail, and we're doing good things in terms of revenue with the jail. She also kind of teed up that we've got retirees on the horizon.
Yeah.
And Lake County's got their own staffing struggles. It's kind of a perfect storm for wages for corrections officers. We're kicking off, you and Suzanne and the Sheriff's Management Team kind of met to look at the Unit 2 contract and what's it gonna look like when it expires at the end of this year. And when we see what Lake County is doing to wages to attract officers, it's an upward escalation. So I just wanna get that on the table. We are making a lot of money. Our revenue's good right now, but there's gonna be a premium on these corrections officer positions in the years.
So we heard, it's not signed off by everybody, so it's probably going through the committees, that their contract is 10.65 for wages. There's longevity, there's sign-on bonus, there's all kinds of other frills that maybe aren't as attractive to our people, it seems, but the wages, everybody knows the wages. And there's things that we know, this is a safe environment that they work in here. The community is great. They've got support not only from our administration, but from you guys. They know that. So there's a lot that
to sell about this, and I'm
Sure.
not suggesting we need to chase Lake County exactly, but there is some upward pressure.
Yeah.
We have some cushion.
Just want to thank you for letting me just get that on the table.
No, I appreciate it. Something to know. Again, we have no need for an executive session, so there being no further business, I'll take a motion to adjourn. Ms. Wagner, seconded by Mr. Cummings.